Good afternoon, everyone. My name is Tony Chicatel, and I work for California Advocates for Nursing Home Reform, also known as CANHR. Thank you for joining today's legislative briefing on the issue of California nursing home finance. And I know that sounds pretty exciting when I say it out loud, nursing home finance, but there has never been a worse time ever to be in a nursing home. And these are very dark days for residents. And the way we fund the facilities and oversee them has contributed to the low quality of care residents often get, which itself has contributed to the horrifying COVID-19 outbreaks and deaths that residents have experienced. To kick off our event, we welcome Liz Fuller, the Chief Consultant of the Assembly Long-Term Care and Aging Committee, for some opening remarks.
To keep and align with exciting remarks, I'll welcome everyone virtually. Thanks everybody for being here. I think that we're all in a time where a lot of the work that we were looking to do to build up around senior issues is really held in limbo because we're all waiting for this master plan that we hoped would be out by this time and now looks probably more than likely to be out more than likely in January than December. But the Assembly has held three hearings since June around the nursing home issues. The Department of Public Health has put out data that says that our seniors 65 and older represent about 10% of the population, but Ross, stop kicking. Sorry, I'm homeschooling at the same time. That we have 10% of the population representing 75% of the deaths related to COVID. And I think that statistic in and of itself is really alarming and something that we have to pay attention to. In some of the hearings, we've really gone in depth as to the why we believe that is happening, but some of the fixes are still not really solidified. And I think that we can't say that this is a lessons learned environment because we're still learning as we're going, and this doesn't have an end date. So as we hear from CANHR today, I want to thank personally, you're a great resource to me as a legislative staffer. So I thank everyone at CANHR who has always really, really made themselves available to any other legislative staff. I encourage you to reach out to CANHR. They're a great resource. And also, as we all learn, what are some of your legislative fixes that you bring forward today? As a sponsor, I think CANHR comes with a great depth of knowledge. So thank you very much. Thank you for asking me to be here today, and I look forward to learning along with everyone else. Thank you.
Thank you, Liz. All right, so I'm just going to give a really quick pre-pandemic snapshot of nursing homes to sort of frame everything, and then I have a few things to say about the pandemic, and then we'll get into our speakers. First, I realize that some people don't know exactly what nursing homes are, so I want to explain that nursing homes are characterized mostly by the fact that they're institutional healthcare facilities with a required 24-hour nurse presence. That distinguishes them from assisted living facilities where you don't have the requirement that there be a nurse on staff. Nursing homes, you have to have a licensed nurse on staff 24 hours a day. Most of the residents are coming from the hospital. They're there for rehabilitation, usually for a few weeks or maybe at most a couple of months, and then they go home. They're recuperating from a stroke or surgery or something like that. The rest of the residents are long-term care folks, what we call custodial care residents, who have chronic conditions that require a lot of assistance with activities of daily living like toileting, feeding, and bathing. The operative goal of the for-profit nursing homes is to maximize revenue and minimize expense. Now, that's true in every for-profit industry. But what makes nursing homes unique is that the revenue is almost entirely from the government. So revenue comes not from investing in high quality of care or satisfying your customers, but from coming to the government with their hands out saying, we need more money. How do they do this? They hide profits and claim that they are losing money. They exploit the reimbursement system and they shortcut the regulatory requirements that cost money to satisfy. And they've been enabled by a state enforcement system that is very tolerant of poor care. Now, sort of switching into the pandemic, so that's pre-pandemic. Now we've got the pandemic, and we've learned that coronavirus is pretty much a near perfect death virus for nursing homes. It thrives on the close contact, high density situations that we find in institutional settings. It's marked by asymptomatic spread, which has been particularly problematic for employees introducing the virus into facilities. And for people with comorbidities, that's conditions that compromise your health, it's been disastrous. And that's the vast majority of nursing home residents, if not all of them. But the virus has also thrived on the pre-existing systemic problems. There's poor infection control. There's chronic understaffing in some facilities, particularly among registered nurses who have been very violent in limiting the spread of COVID-19. And it thrives in systems of facilities that are operated by owners with bad track records. The nursing home narrative, and they've been pretty aggressive in pushing this narrative, is that COVID-19 has been a disaster for them because of underinvestment from the government, that they're under-resourced. But that is simply untrue. The worst facilities with the poorest records of care generally have the biggest and most deadly outbreaks. It's not been about resources, it's been about competency. And in California, unfortunately, there's a lot of provider incompetency. The systemic nursing home problems, which have always been enabled by failures and oversight, have been amplified by COVID-19, enabled in part by Department of Public Health missteps. And I'm just going to give you a few of them. In the first few months of the pandemic, the state of California conducted over 1,000 infection control focused surveys, and they took no enforcement action in any of them. Some right in the midst of a massive COVID-19 outbreak in the facility. We have instances where DPH was in a facility giving them a clean bill of health related to infection control, and the very next day the facility had to be evacuated because the staff was overwhelmed by COVID-19. Department of Public Health has always flirted with a kind of sort of mandate for nursing homes to take COVID-19 positive residents. We think that's a pretty bad idea. There's been massive resident isolation and weight loss. So many reports of isolation and weight loss. The Department of Public Health failed to have its on-site surveyors, inspectors, COVID-19 tested until about August or September. So for many months, inspectors were going on-site into facilities not knowing whether they themselves had coronavirus. The department is still insisting on suspending its comprehensive survey function. It's only focused on infection control right now. So we've had no review of facilities' quality of care. We've had no review of residents' quality of life in any meaningful way since March. So we're coming up on a year on that. The department has been dispensing staffing waivers, allowing facilities to staff below the minimum requirements incorporated by state law. They've been handing out these waivers like trick-or-treat candy. And the situation is now such that we have around 200 nursing home residents dying every week from COVID-19. So it's pretty bleak out there. And what kills me, what kills CANHR, is it didn't have to be nearly this bad. So that's my framing. It's pretty dour. I'm sorry about that. But so I'm going to turn to our speakers for today. Our first speaker is Ernie Tosh. He's an attorney and nursing home expert, particularly on nursing home finance, and he's from Dallas, Texas. Ernie loves so much. He has the term sample size tattooed across his back, and he has a confidence interval on his Christmas list. And yes, I wrote those jokes myself. After Ernie provides his insight, we have Dr. Charlene Harrington. She's a professor emeritus from UCSF and a preeminent nursing home expert. And to my knowledge, Charlene has no tattoos. Then I hope we'll have a good chunk of time so that we can do some Q&A, and I look forward to this, and I will turn it over to Ernie Tosh.
Thanks, Tony. I do have a lot of tattoos, but they are not of statistical formulas. I'm going to talk about basically nursing home finance, and just to give you an idea of why Tony's asked me to come in. I do nursing home litigation cases, but I also testify as an expert all over the country in nursing home finance and staffing. And basically, I'm not a standard of care expert like Dr. Harrington or Dr. Halifax. I am an expert in data. And I've accumulated the single largest privately held collection of nursing home data in the country. And with that data, we are able to do a tremendous amount of research and exploration without actually having to get into litigation discovery to find stuff out. So I want to share my screen with everybody. I've got a little PowerPoint that I want to go through. I tried to make it colorful and kind of fun because this is not a subject that is traditionally exciting to talk about. But let's see how we do. So nursing homes in 2020, as Tony said, they want to claim that they're losing money. They need more money. They need more Medicaid reimbursement. They need more Medicare support. But really, nursing homes in 2020, it's all about deceit and greed. This is what we think of a nursing home when we, are a nursing home. It is a business. It has revenue over here from Medicare and Medicaid, may have some VA clients, some private pay clients. And over here you have expenses. Nursing staff, usually the largest expense. Rent, therapy services, supplies. So you're just a normal business. It has money coming in, it has money going out, and at the end of the day, they hope to make a profit. And when we talk about making a profit, we're talking about revenue minus expenses. Super easy math. It's just elementary school subtraction. You brought in $1 million, you paid $800,000, your income or your profit was $200,000. It's very straightforward. Now, nursing homes used to be just a local facility. We call them today mom and pop operations. That would have been, in a local community. The only ones we see now that are like that are single standalone facilities, are usually in rural areas that have been held by a single owner for decades. Most of the other nursing homes have been sucked up into giant corporations that provide for-profit nursing services. And so you will have your local facility, and then that local facility will be, classified into a region. It's California, Arizona, and Utah is their region. Then you have, the national chain that has 500 facilities across the country. And so they just get increasingly larger and more complex. What the nursing home industry is trying to sell us is one picture, and what I'm going to show you is reality, and they're completely different. What the nursing home industry wants to sell you is that they have this little nursing home. It's the one right up the street from you, and it's just this one poor little nursing home, and it's just trying to do the best it can in a hard time. But after they pay all their expenses, they have nothing. In fact, they may be upside down. They may be losing money, and they need more governmental assistance or they're going to go out of business. But it's all smoke and mirrors, all of it. Okay, the accounting inside the nursing home industry is absolutely smoke and mirrors. Okay, I'm an ex-prosecutor. That's where I started my career. When I first was exposed to nursing home financial documents, they were brought to me. I wasn't even doing civil law. They were brought to me to see if I could read them because they were so complex that this one litigator couldn't make heads or tails of them. And my background being in finance and math and computer science, I was able to read them. And as soon as I saw them, I realized that what they were doing was they were running an operation that looked just ridiculously similar to organized crime, where you have one body making the money and then you launder the money to hide it. And that's exactly what they're doing. So this is how they do it. It's done through related party transactions. Related parties is normally defined as being a corporation or corporations that are related by ownership to the nursing home. Okay? So again, when we first started and we're thinking about the nursing home, we were just thinking about this one little entity called the nursing home. But the nursing home buys services from a therapy company. They lease their building from a leasing company. They buy their drugs from a pharmacy. They have a management company. They may employ agency nurses when they don't have enough of their own nurses. And there is insurance, property insurance, medical insurance, professional liability insurance. So they have all these services that are buying from other companies. But it turns out that all of these companies are related. They're all owned by the same company that owns the nursing home. And that's what makes them related parties. You have a parent corporation that owns the nursing home and all the sibling companies as well. Now, it's not illegal to have related parties. It's perfectly fine. But under federal and California reporting rules, they have to report who the related parties are and how much they're paying the related parties. The scam is you overpay all your related parties. Think about rent. You rent a building that is worth $1 million a year. That's what you should be paying for your rent. But because you own it, you pay yourself $1.5 million. And so what you've done is you've taken $500,000 from the facility and you moved it to your leasing company, which now makes your nursing home look less profitable. And we can't see this money anymore. Okay? Once it passes this wall into the related parties, the money disappears. And so the game is to siphon as much money as possible out of the nursing home and into your related parties so it can disappear. And then when you file your cost report with the state of California and with CMS on the national level, you tell everybody you lost money. And the reason you lost money is because you overpaid all of these related parties and you sucked all the profit out of the facility. Now, with the COVID pandemic, what we figured out was they didn't just suck out all the profit. They sucked out all the PPE money as well. They didn't have adequate PPE storage. Why? Because they sucked all their supply money out too. And so the facility was absolutely naked when COVID hit. They say couldn't get enough nurses. They didn't have the money for nurses. Why didn't they have it? Because they sucked it dry right before COVID hit. What you see on their cost reports is this is the same facility. It's the same facility we just saw. It had $1 million in revenue. A little while ago, it had a $200,000 profit, but now we used our related parties and we overpaid them all. And so now we can make our expenses look like 1.1 million. And now, oh my gosh, we're losing money and we need more state money and we need more federal money and we're going to go out of business. It's not true. The $200,000 of profit was actually made and it was moved to the owner who spent it on, his Learjet. So again, the nursing home industry is trying to sell us that their nursing homes are making no money and they're about to go bankrupt. When in fact, their nursing homes are making vast amounts of money. It's just that they know how to hide it. There's no transparency. And what we need is the difference between accounting and auditing. Okay? Accounting is just filling out forms and putting numbers in there and keeping your checkbook accurate. And that's what accounting is just filling out the paperwork. It's just filling out the cost reports. Yeah, we paid our related parties $3 million last year, and we grossed, $8 million in revenue and blah, blah, blah. That's what the cost reports are right now. It's just accounting. What we need is auditing. We need a system in place that is specifically looking at the money trails, okay? And I'm going to go into some recommendations in just a minute as to how to do that, to do it effectively, and you can do it without spending a lot of state money, and you don't have to hire a truckload of auditors. What you have to do is you have to require the facilities to file more information and more accurate information and make that information publicly available. Because there's someone like me out there that can take this information and show the world how this is being done and can show the world who's actually making a profit and who isn't. And then you can make really informed decisions on whether you want to spend more taxpayer money funding millionaires with Lear jets, or do you want to require that they spend that money on actual nursing services and still make an okay profit? But at this point, we don't know how much money they make because we're not auditing, we are just accounting. So along this process of transparency is several ideas, okay? They're not earth-shattering ideas and they're not difficult to implement. Require all the nursing homes to file organizational charts as part of their annual cost report. Okay, they've got those charts. I get those charts in litigation in every case. It says, this is the top company. It owns all of these companies, which own all of these companies. And you can see who's interrelated, okay? Second thing, require all the nursing homes to file consolidated financial statements that cover the entire organization. Right now, when you take a cost report from the state of California or even from the federal government's annual filings, you're not looking at the organization. You are looking at one small piece of the organization. In our example with our little piggy bank, a single cost report for a single facility in the state of California is the fingernail of that animal. We want a filed consolidated report from the entire organization because we understand how they're moving their money out of the nursing home to hide it and have zero transparency. We want to see the whole corporation. If the corporation is making $1 billion in profit per year, guess what? They don't need any more taxpayer money, okay? So consolidated financial statements that cover the entire organization. Again, that doesn't cost the state of California anything. That's just a requirement of the facility to continue with their licensure. Third thing, and it kind of bumped up my slide here so you don't have to read the whole slide again. We're just down on the third bullet. Require that your financial statements be audited by a CPA using generally accepted accounting principles and financial accounting standard board's requirements. Okay. This is the auditing component. Okay. We're not going to just be satisfied with accounting. We want auditing. And this again costs the state of California nothing. Require that the facility and the organization file these documents, have a CPA audit them using these generally accepted accounting principles and FASB requirements, and you will get good audited information. And because we're getting it for the entire organization, we get transparency. Counter argument, of course, when you start talking about this stuff, is the narrative that the nursing home industry is pushing right now. We're doing the best we can. You know, we've always been on the brink of bankruptcy. 2020 is the worst ever. We need more money. We need more money. We're doing the best we can. But the problem is, this is all fraud. Okay? And I don't use that word lightly. I use that word as an ex-prosecutor. What these facilities are doing is absolutely fraud. They are organized criminal activities. Okay? I don't understand why they don't get prosecuted criminally for this stuff. If I was in control of the world, some people would be going to jail. One of the ways they commit fraud is called Medicare length of stay fraud. In a facility, when somebody comes in from the hospital that has had, you know, a hip replacement, knee replacement, shoulder surgery, maybe have had a stroke, they go into a facility to get rehab. That rehab normally takes between 21 and 28 days, 3 to 4 weeks. Okay, that is the national average length of stay for Medicare. When you see a facility with these numbers, this is length of stay fraud. What they are doing is holding the individual substantially longer so that they can continue getting Medicare reimbursement for a longer period of time. Okay, you can effectively double your Medicare reimbursement for the year if you are running a 50-day average length of stay. So this is length of stay fraud. Also, all the slides that I'm showing you are from facilities in California, and it took me all of about 5 minutes to put them together because it's all over the place. I see fraud all the time, just every day. This is discharges. This is a little unusual. And this came about when I was doing work with the California Nursing Home Fraud Task Force, and they were looking at wrongful discharges. And what we've got here is day 20, and what we've got here is how many people discharged each day. And day 20 is important because that's the day that the Medicare reimbursement rate for the individual drops from 100% to, I think, 80%. And so that difference has to be made up by the individual, a supplemental insurance policy, the family, or the facility has to eat it if they can't collect it some way. So what we see here is, yeah, there was more discharges around day 20, but you know, it was a pretty good staggering after that. In this facility, this is discharge fraud. Leading up to the 20th day, they hammered to get people out of that facility. And as you can see, a significant drop off after that. Literally, the 20th day was a cliff. And as it turns out, this facility, after investigation by the Fraud Task Force, it was in fact committing discharge fraud. They were not giving people adequate discharge notices, et cetera, et cetera. It was just a dumpster fire. Medicare rugs is another area where you've got, these are the percentage of days of people who have rehabilitation and how they're classified. So what that means is somebody comes in from the hospital, they're classified to need rehab, and there's 5 levels of rehab: low, medium, high, very high, ultra high. And what that means is low rehab, you're never going to have somebody with low rehab. That's 45 minutes a week. You're not going to go to a nursing home for 45 minutes a week. So, you know, as you go up, it's more minutes. I think it's 350 for high, 525 for very high, and then 720 minutes a week of rehab if you're an ultra high. And what we see here is a fairly normal distribution. This one's a little bit weird, but you know, this is the kind of distribution you expect to see if a facility is evaluating properly. If they're committing upcoding fraud, this is what you see. You see a hard right-hand spike in ultra high. They're pushing everyone into the 720-minute classification, and they're billing the ever-living crap out of Medicare for it. This facility should be key-towned immediately. Why the federal government doesn't track this, I have no idea, because I can see it. And 2 summers ago, one of my sons and I did a study on this, and found that in the top 50 chains in the country, we identified over $1 billion of fraud over a 4-year period. So it's easy to find. You just have to look at the information. 5-star fraud, another kind of fraud, happens all the time. There's 2 different filings that we look at for this. We look at the filings of their staffing to OSHPD in their annual cost report. How much staffing did they report? And then we look at how much did they report to the federal 5-star rating system. The 5-star rating system is on CMS Compare. It's the only national comparison site that there is. And everybody, if you're doing comparisons of nursing home, that's where you're going to go. And what they do is they lie to the federal government about their staffing so that they can get a higher star rating and look better than the nursing home up the street. This is a facility that was reporting accurately. There was a little bit of variance between what they reported in the 5-star system and what they reported to OSHPD. But then we see in the next 2 years, they significantly over-reported in every quarter. And in the following year, it was even worse. Massive. I mean, look at this. This is 33% of that they reported more in the 5-star system than they reported to the state. This was purely to rig the 5-star system and falsely advertise to the public that they had more staffing than they actually did. Okay. 5-star fraud, when they do that, looks like this. This is what showed up on CMS's website. 5 stars for staffing and for total staffing and RN staffing. It should have been 3 stars. 4 stars should have been 1 and 2 stars. 3 stars should have been 1 star. So this facility over this 3-year period was absolutely lying to the public about their staffing. Then there's just understaffing in general, where you staff at the state minimum, but your acuity level is significantly higher. Acuity meaning how much nursing care does a patient need. We know how much nursing care every person needs because every person has an acuity score that is assigned to them using an assessment. It's called an MDS, minimum data set. And the score is called a RUG score, RUG, RUG, Resource Utilization Group. And with those RUG scores and with the timetables from time studies that CMS has done, we can calculate how much time the nursing home should have staffed for. We can compare it to what they did staff at, and we can actually calculate what that difference is worth. And for this facility that we've been looking at today, they were pocketing $1.2 million between what they should have staffed at and what they actually staffed at. And then what did they do? They tried to make their facility look like it was bankrupt. They committed upcoding fraud. They committed length of stay fraud. They committed overpayments to related parties by over $200,000 a year. They understaffed by over $1 million a year and showed a loss on their financial statements. But in fact, when you reverse all their transactions and figure out how their finances actually work, they were actually extremely profitable. Unfortunately, there's no telling how many people they killed in the process of committing that fraud. It's all smoke and mirrors. When you are in the legislature and you're hearing the sob stories from the nursing homes, remember this is smoke and mirrors. They are showing you the toenail instead of the entire animal. Require them to be transparent. Don't give them any more money until they give you absolute transparency. If they want your money, they'll comply with what you request. And we're not requesting that the state expend a ton of money to get more information. Just require them to give it to you. This is who I am. This is my contact information. I am here to answer any questions people have. I'm available to be contacted by email or by phone to discuss this. I am very passionate about this. My passion lies in the prosecutorial side of me, in that we have bad people doing bad things to victims who can't stop it. And I want to be part of stopping that. So that's my presentation, Tony.
All right, thank you so much, Ernie. Charlene, can we have you supplement what Ernie's talked about?
Yes. Okay. Thank you, Tony. That's very useful, Ernie, to just go through the steps of how this is working. And I have been looking at nursing home companies and the staffing issues and the financial issues for at least the past 15 or 20 years with colleagues at UCSF. And our research shows and verifies many of the things that Ernie has talked about. And I've also worked on some of the legal cases where we find exactly what Ernie has laid out for you. So I think that the situation with nursing home quality is clearly related to the fact that nursing homes are not providing adequate staffing. And during the past year, the COVID crisis has gotten worse because they haven't provided adequate testing of the staff and adequate PPEs. So the whole situation comes down to the fact that they are taking money out to maximize profits and not putting resources in to ensure that we have adequate quality. And that accounts for the fact that less than 0.5% of the population in California that live in nursing homes represent 26% of all the deaths in California. So we really, in order to get the resources to where it should be going, we have to require the transparency. And I totally agree with the recommendations that Ernie has laid out in terms of requiring a consolidated cost report and requiring a certified public accounting audit of the cost reports. Now, California claims that we've had cost reports for many years, but the person that from the company that sends in the cost reports only has to certify that it's accurate under penalty of perjury. There's no way to check the accuracy because they are not providing all of the details that an accounting firm would provide. So that is not an adequate requirement. And so we do want to see certified auditing. And as Ernie says, they're not providing the reports from all these related parties. Now, in 2018, California passed a bill that does require that nursing homes that have over $10,000 in related party transactions need to provide a profit and loss statement. And so that's a good step forward, which is going to be implemented next year. But again, that's totally not sufficient because that's not going to necessarily include the parent company. And there's no way to check to see if they've left out related party companies because we don't have a detailed organization chart to see what their companies are. Now, so I think this is a fairly easy fix because, as Ernie said, it's not going to cost money. And it's very exciting that New Jersey has adopted what they call a direct care ratio this year, which is basically requiring nursing homes to spend 90% of all their money on direct care services and only 10% on administration and profits. And I just heard today that Massachusetts has similar legislation. So this is something that the industry is, of course, totally opposed to, but I think it's a really crucial step that we move forward. So I'll just stop there and say thank you, Ernie, for laying this out to us.
Thank you, Charlene. Okay, so I want to encourage questions at this point. You can use the chat feature, and I can present the questions to the speakers or to any CANHR staff who want to contribute, or you can just, I think you can unmute yourself and chime in with your question.
Tony, this is Blanca from
Blanca.
AARP. First of all, I want to say thank you so much to you and to Liz Fuller from Aging and Long-Term Care Committee for hosting today's discussion. This is very critical and so eye-opening. So thank you so much, Dr. Tosh and Charlene, for your information. Here are a couple of things that stand out for me. One is that I appreciate the use of the word deceit and greed. That's really the kind of approach that we had to take when we took on the pharmaceutical industry, when they were, and they do continue to have pay to delay contracts, but we were able to pass legislation in California under very heavy lobbying by the pharmaceutical companies, both generic and otherwise. And they're now suing us in California. So we did something right. And so it sounds to me like this is one of the messages, is the deceit and greed of this industry, and really just calling it as it is. I think that's what part of the information and education we have to do. And then the other thing I just wanted that really came to me is that ARP has been releasing CMS data that they obtain. And what you shared today really explains why California's data is showing that, well, by God, we have never had or have very little problems with staffing ratios in all our nursing homes. That's what they're reporting to CMS. And so there's already the very fact that we're going to an entity like CMS to obtain data to share to the public is only giving them more ammunition, if you will, to say, see, we're doing such a good job. So Dr. Tosh, I do want to bring this up to our national team, so that's on another side. But for this audience, whatever ARP can do, we are there, because what is absolutely necessary is we need to be angry and just be very vocal about what's actually happening, and then give those solutions, because that's what legislators need, is a solution in a box so that they don't have to do all the other work. So to whatever extent we can draft model language or anything so that we don't have to ask for too much, but simply say, this is all you have to do in order for us to really bring some real clear how to opening these windows about what's been happening in the nursing home industry. And I'm appalled. And one of the reasons I didn't put my mother in a nursing home, but brought her home, because I had a feeling that there weren't too many in the area that we lived that would care for her at the end of her life. So thank you so much.
Tony, I just want to say to Blanca's comments there, and I think Karen Jones may have asked a question about this that I saw pop up at the bottom about the sources of the information that we have. And I'm sorry, my dogs are going crazy outside. The joy of working at home. The information that we have is primarily through public information from CMS. We get PBJ data, which is payroll-based journal staffing data, CMS 671, which is staffing data that is no longer collected, the CMS annual cost report, which is called the CMS 2540-10. In California, we get the OSHPD cost report. The problem is, again, with the auditing and the non-transparency of looking at a small piece of the organization as opposed to the entire organization. You can manipulate the financial statements of the little pieces of the organization to make them appear any way you want, but you can't necessarily manipulate the entire organization's financial statement. And so that's why that becomes so important. The other thing I wanted to say about data and where we get it is, I've been fighting a lawsuit against CMS to get more data. That was a suit that I started 3.5 years ago, thinking that, oh, I might spend $50,000 on this, but it'll be worth it to get the information. Just to let you know, I spent $300,000 on that litigation. But what I got out of it was 125 million MDSs. So I can now calculate staffing needs in every facility for every day for the last 8.5 years. And so with that data, it gives us more power to go in and show how understaffed these facilities are every single day. It is not an accident that they are understaffing. It is not an accident that these facilities have no resources. It is all part of the master scheme that is run by the giant organizations. So again, my big overriding thing on all of this is transparency. We are spending billions and billions and billions of taxpayer dollars in this industry. We should have absolute transparency. And if they won't agree to transparency, then we should not agree to pay them. So that was me on my soapbox from being a prosecutor. Sorry about that.
So, yeah, Ernie, Mike Dark asked a question about what rationales do the industry offer for this sort of complex web of ownership? Is there what that obviously they're not going to say we do this for money laundering purposes. What's their defense?
Their defense is that other organizations also do this, that, hey, look, if we had to go hire a therapy company to do this, we would expect to pay them X amount and they would make a profit off of it. So why shouldn't we have the rehab company and keep that profit in-house? There's nothing wrong with that rationale. It's called a vertical supply chain. And there's nothing wrong with that as long as you continue to service the clientele to the level that they are supposed to be serviced. And that's where the problem comes in, is that they're siphoning the money and not providing the service. Now, the true reason that they use these very Byzantine complex organizations is twofold. One, it allows them to go to the legislature with cost reports that make it look like they're losing money. And so they can hold up a cost report and say, look, we're losing money, we need more money, blah, blah, blah. And I fully understand how they get away with that, because the legislators have 1,000 decisions to make this week. And they can't be an expert on any one area. They can't be me, who has spent 10 years collecting data and researching this industry. But hopefully they can reach out to people like Tony and Dr. Harrington and Dr. Halifax and myself to help them understand where the pitfalls are so that we can avoid making more bad decisions. But so that's one thing. They create these structures so that they can create financial statements that get them in front of the legislature crying. The other great benefit of having these Byzantine structures is that it protects them against liability and lawsuits, because we sue the nursing home. But guess what? The nursing home has no assets. So if we get a multi-million-dollar judgment against that nursing home, they will collapse that nursing home into bankruptcy and open it up 20 minutes later under a different name. And now our multi-million-dollar judgment evaporates. So it is a collapsible strategy at the lower levels that allows them to walk away from their negligence when we get justice for it. So what we have to do is we have to fight through that. We have to start suing the management companies and suing the parent corporations. And that creates massive amounts of litigation costs because we are having to do huge amounts of discovery and depositions to figure out who actually set the staffing at this nursing home. It wasn't the nursing home. It wasn't the management company. It was the board of directors who signed off on 3.7 hours of staffing per patient per day when this facility really needed 4.5. But it takes us 2 years and $150,000 in costs to figure that out. And so that is why they do it. They want the litigation to be so expensive and so protracted that we won't do that. Instead, we will take their crappy little $100,000 insurance policy, tuck our tails, and go on down the road. And what did they do? They walked away unscathed again. And so anyway, the entire extremely complex business model is put in place to make money and to preserve their assets in litigation. So that's the takeaway.
Yeah, thanks, Ernie. There was an article that appeared, I think in June or July, from one like Atlantic Monthly, or somebody did a story about, it started with it was a 2005 article written by a couple of nursing home defense lawyers about how to evade liability by creating all these shell LLCs. And then it sort of had this significant additional benefit of being able to use to hide money around. I can't remember the article, but I'm going to put that in the packet just so everyone knows. Everybody who registered for this briefing, you're going to get an email from me that will have some more information in there. It will have a link to a recording of the briefing so it can be shared, and then I'll make sure that article goes in it. That describes a little bit of this maneuver, why this maneuvering happens.
Right, and I think it's actually a 2004 article, Tony, and you're exactly right. It was set up in such a way as to protect assets in litigation. And once that article was released to the industry, within probably 2 or 3 years, the entire industry had restructured. And what it does, if you think about it, is the original model had like the nursing homes assets, their vehicles, their real estate, their accounts receivable was all in the same LLC as the nursing home license. And so if you sued them and you were successful, you could literally take their building. Okay. So what the new model does is it peels the building off into its own LLC. And now we can't reach it because it's not involved in the litigation. And we can't reach their vehicles. And we literally can't reach any assets because they drain physically. This is not an overstatement. They use sweeper accounts at their banks that at 12:01 in the morning sweeps all the money from all the facility accounts into a master account for the home office. So every single night at midnight, that facility is worthless. Okay, so that's what we're fighting.
Okay, really good question here from our director of our Ombudsman Association. She says, well, since I've been doing this, it's been a long time now. We have 1,200 nursing homes or so in California. Today, we have about 1,200 nursing homes in California. If there's so much money to be made, how come there's, people aren't just charging hard to get into this business? I've got an answer, but I want to hear from you and Charlene.
Well, you kind of broke up there, but I think the question is, if this area is so profitable, why aren't more people coming into it? Is that correct?
Exactly.
Okay, they are coming into it. the average value of a single bed in a nursing home is in excess of $100,000. So, and that price continues to go up. So it is, if you're thinking about a stock market, this is an ever increasing graph of the value of a bed in a nursing home. The ones who are coming into the market are massive players. They are private equity firms and real estate investment trusts. And they're coming in with billions of dollars of assets, and they are sucking up the nursing home industry. So yeah, mom and pop operations don't exist anymore. And even small time operators really can't get into the business anymore because it is so expensive to purchase a nursing home. So yeah, they're making, and why would a REIT? Okay, think about a real estate investment trust or a private equity company. Their only job is to make money. That's their only job. Their job is to return a certain amount of interest or profit to their investors. That is all they're in the business for. They are looking for the market that will give them the highest rate of return with an amount of risk that they feel comfortable with. Okay? Why would a company like that be sucking up nursing homes like they're Tic Tacs if they weren't profitable? A real estate investment trust and a private equity firm is never going to invest in a loser proposition. Okay? The fact that they are coming in force in this industry is plenty of evidence that there's tons of money being made in this sector.
And I could just add that we've seen all kinds of buying and selling going on just since the epidemic started. So private equity has been jumping in and buying up new companies all over the country. So what Ernie says is correct. And they're not seeing the pandemic as a problem because a lot of states like California increased the reimbursement rate for Medicaid. Congress has given out over $21 billion to nursing homes and not requiring any accountability for that money. Plus, the pay rates for COVID residents has gone up as high as $1,000 per day per patient. So they're seeing COVID as a money-making situation.
Yeah, and I'll just add that the reason why I don't think we have a significant higher number of nursing homes is because of the demand for nursing homes is pretty much capped. People try to avoid nursing homes, I think rightfully, like the plague. So what you've got is this sort of consistent population of people who just don't really have any other options, either because they need significant care, short-term or long-term, their families just can't keep up with it. So and the way our reimbursement system is set up, it doesn't offer a lot of home and community-based options in some cases. So they're sort of forced into nursing homes, but everybody else avoids them. So I just think there's not a lot of demand growth. But what we've had is there's a lot of fighting over for the demand that we have. And that's why we get the exchanges and the turnover and ownership.
Yeah, there's about an 86% occupancy rate, maybe even lower. It might be 84%, which means that 16% of the beds in California are at some point vacant. Now, the nursing home industry likes to, whenever they're trying to get more money to build more beds, they'll say, well, it's a 96% occupancy rate, so, so many Medi-Cal people and all of that. But I'll tell you, Ernie, I remember years ago when they were all publicly, but most of them were public corporations. You could get all that information. We used to do very detailed reports about who owned what exactly what kind of houses they had, what kind of cars they had, their private planes, all of that. Remember Sun Healthcare? I mean, they bought $1 million Picasso to hang on their CEO's wall. So they decided to start hiding their assets, and they've done a very good job of it, unfortunately. Anyway, thank you so much, Charlene and Ernie, for doing this too. And Tony, of course.
Yeah, thanks everybody. I think, we've run out of time. I want to be respectful of everyone's time. I want to thank Liz and Ernie and Charlene for joining us. I've saved the chat. I will be responding to some of you, but all of you will get a follow-up email from me with some information. And we've got a lot of questions about sample legislation, legislative language. We're happy to provide that as needed. So thank you very much for joining us, and have a happy holiday season. Thank you, everyone.
Happy holidays.